Hi, my name is Wendy Lee. I'm one of the pharmacists here at our Taylor Street location of Hawthorne Pharmacy. Today on We Care Wednesday, I want to talk to you a little bit about a serious topic. I'm going to talk about esophageal cancer. As many of you know, I lost a very important person to me past January to esophageal cancer, so I want to kind of give you a little insight on this disease and how you can help prevent it. The esophageal cancer is a very preventable disease. In American men, esophageal cancer is the fastest increasing cancer diagnosis at this time. It actually has a 600% increase in the last 35 years. We know it is preventable and if it is curable if it is caught early. In many cases, though, it's not caught until late stages of cancer, which can be very problematic. There's two different types of esophageal cancer. There is adenocarcinoma, which is the most common type that we find in our Western world. It's usually a result of long-lasting reflux. So acid reflux can actually cause cancer. So that is probably the most popular. There's also what they call squamous cell carcinoma, which is more linked to like smoking and excessive drinking. So those are the two types. We do know that esophageal cancer, the survival rate is very low, especially when it's in low, when it's considered stage 4. They actually say only 4.6% of people that end up with stage 4 esophageal cancer will survive over 5 years. So this is something a very, very important topic that we need to discuss. We know it's preventable. We know that once it is diagnosed, if it's diagnosed early, it can be treated. A lot of people say, well, how do you know if you would have esophageal cancer? There's many signs and symptoms that can occur before diagnosis. You should definitely talk to your doctor if you have occasional heartburn symptoms. If you're having to take over-the-counter, what they call acid reducers, if you're having to take them chronically, definitely talk to your doctor because that is something that could lead to esophageal cancer. If you've experienced heartburn in the past and then all of a sudden the symptoms go away, sometimes that could be a sign. If you're having pain, if it's hard to swallow, those are definitely signs. If you have a family history of what they call Barrett's esophagus or have a family history of esophageal cancer, you should be screened more frequently for esophageal cancer. An unexplained cough could be a sign. Also, if your voice gets very hoarse over several weeks, that could be a symptom that there is something maybe possibly blocking your esophagus, like a tumor. So it definitely need to be checked out. A persistent unexplained sore throat can also be a sign. And also when you lie down, if you start coughing or choking, that could definitely be a symptom. So that's something you should talk to your doctor about. How is esophageal cancer diagnosed? Typically, it's discovered by what they call endoscopy, where they actually, the doctor will actually put like a camera down your throat and see what's going on. Also, it could be diagnosed from what they call a CT scan or an MRI. So all these are different methods of how they can scan for esophageal cancer. Once esophageal cancer is diagnosed, there is treatments. There's different types. There's radiation treatments, there's chemotherapy, there's immunotherapy. There are definitely different types of treatment that can be used for esophageal cancer. So if you have questions about esophageal cancer, if you know someone that is having some of these symptoms, I definitely say reach out to your doctor. Also, there's a lot of information from what they call ECAN, which is the Esophageal Cancer Action Network on it's ecan.org. I'll put the link attached in the comments of today. But I hope everybody is having a wonderful 2022 and stay healthy.